Hi, I'm Dr. Leslie Pasco, and I'm here at MGE at the Owners Conference. Now, this is a big conference because this is the first time ever that we've had clinical CE education available to our clients. And I'm sitting here with, well, you know who this is. This is Dr. Gordon Christensen, and he gave us an amazing talk today. Thank you. Yeah, you're welcome. Thank you so much for being here. It
My
really
pleasure.
It's an honor. It really is an honor to have you here with us. Now, I want to talk about what you were talking about today in your talk. What is the one thing that you want our clients to take away from what you were talking about today?
There are so many new things in the profession that we could literally go a week and not exhaust the topic. Every area has new things. We have a new specialty, and that's oral and maxillofacial radiology, and the cone beam has stimulated that. I would like them to take away from that part, the clinical part, that they must keep up constantly with what's going on, that they must be involved with study clubs, they must be involved with organizations like this.
Yes.
To be on the forefront, to be on the tip of the iceberg. If they're not doing that, they're back where they were in dental school, and the same kinds of techniques, same kinds of concepts. But more importantly than that is they've got to be proactive in their thinking about the profession. We are the number one health profession, as you heard me saying.
Yes.
Being the number one health profession is going to take some proactivity to stay there, because
Absolutely.
every side is trying to beat us down to where medicine has gone over the last while, where the third party tells them what to do, when to do, if to do, how to do, when to take a vacation, how much they're going to earn, when they got to have CE. They're commanded in everything. They are virtual slaves, earning a fraction of what they did even years ago. And I'm not really frustrated about the earning part. The earning part frustrates me only from the standpoint that they're minimally able to buy new things to get innovative in what they're doing, because these salaries are so low. Yeah. Many of the dental salaries right now, as promoted by the third party, are not even making overhead.
That's right.
Not making overhead.
Yeah.
So I would like them to take the leadership orientation. They've got to become a leader not only in their practice but in their family, in their professional life, and see where the profession's going and get involved, heavily involved with the ADA. The ADA is trying hard, but it's hard to move the huge organization.
Yeah, I 100% agree with that.
Yeah.
And it's not uncommon for our clients to come to us in the beginning. Mm-hmm. They haven't even paid themselves in months.
Yeah.
Because they can't, because of these third parties and what they're getting paid and compensated. And it's hard for them to run their practice, let alone run their household.
Yeah. We're seeing in the state of Utah, where I am, I won't mention the names of the organizations, but they have fees about 1/2 price what a normal fee would be. And they'll take whatever. They're omitting copay, which is, by the way, a felony.
Yes,
that's
a
felony. They don't realize that, but there are actually dentists in jail right now for omitting copay, but they'll take it just to survive.
Yeah, 100% agree with you. Yeah, we're right on board and we're tracking for sure. Now, I have to just tell you, I'm amazed that I'm sitting on the couch next to you. And I'm wondering, you're just such an amazing man.
Thank you.
Yeah, you're welcome. What got all this started? How long ago? Where did it start? How did this all happen?
My mother died in her mid-80s. She could run circles around any 20 men. She was working in the early 1900s as an executive secretary, which was unknown at that point, because women were supposed to be home making babies and cooking. But she would tell the head dude of the organization, which was a sugar factory, what to do and when to do it and so forth. And that was the kind of person she was. In fact, the day she died, I was practicing, and I got a phone call right in the middle of a patient, and I went over and they said, "Your mother has fallen down and she won't get up." And I said, "She's either had a heart attack or a stroke, because this woman could lift a car." And I was right. She had had a stroke and died subsequently that day. But she was the major motivation. And even though I was a scrawny kid, I was a year ahead of myself in school, so I was small for the size. And she'd say, "Get in there and do that. You can do that. You're as good as him. You're as smart as him. You can do that. You can do that." It was always positive. Never a negative word. Never chewed me out. If I had 5 A's and a B, she wouldn't ask me what the B was about. She'd praise the A's.
Yeah.
It was always positive, literally. A lot of people I revere are like that. In fact, I did a survey many years ago of 100 leaders, and they were religious, medical, law, dental, educational, everything. And I tried to determine what is the overriding single principle that they all had. These are Norman Vincent Peale, they're Eisenhower, they're people you know and respect. And the single most predominant thing from every one of the 100 was positive thinking. You can do it, we're going to do it. Churchill. You think about Churchill. We're not going to stop, we're going to go.
Yep.
You think of the Dunkirk thing that he was involved with, and rather than just saying give up and let those guys get killed, he said, we're going to send out boats over there to pick these people up. Positive thinking, enthusiasm, and the word enthusiasm is major. Enthusiasm means with God, and I think that's a major part of what I've been able to do.
Yeah.
I'm not overtly and irritatingly religious, but there's a big man up there,
Yeah.
and he's guided me all my life. Without that, I don't know where I would be, because I ask him constantly what to do, when to do, how to do.
Yeah.
So that has been it, but probably related to what we were talking about this morning. The frustration I see with trends in the profession that we can't control unless we do it collectively. One person can't do it. One leader can't do it. It's got to be a grassroots orientation that says, this is wrong, and let's change it. And I see that not happening fast enough in the profession. You come home from a day, you know it. You come home from a day, you're tired, you're ready to be with your child, you're ready to have a moment of peace, and you're not ready to go do politics.
Yeah.
But in the meantime, we've got to find time for it, because
right.
they're eating us alive. So
Well,
it's a work ethic. It's a motivation that says there are a lot of people in need. Let's see what we can do to help them. Let's keep the quality up there and not just bring everybody down to the bottom feeder level, which a lot of the organizations are trying to do.
I understand. And you have certainly been a leader in dentistry.
Thank
I
you.
mean, yeah, you're welcome. And I want to thank you for that, because without the things that you have done, we would not have our profession as we have it today.
Thank
with
you.
the integrity and the ethics that stands behind what you do.
Well, thank you. A lot of criticism, a lot of criticisms. You know, when I said this morning we had 700 products we did last year, 1 out of 5 had an honest ad. 1 out of 5.
Wow.
The rest,
That's scary.
the 4 out of 5, we had to weed out the falsehoods.
Wow. That's scary,
It
isn't
is.
it?
It is.
And we believe it.
Yeah,
because it's in the journals.
Yeah. You look through any one of the magazines, so-called magazines now, and you'll find whatever 100 products, and you think, my goodness, if 1 out of 5 of those is only the one that's going to be accurate, something's wrong.
Yeah. Well, that kind of takes me into what I want to talk about next. You know, the future of dentistry. Where do you see it going, and what can we expect? Is it good? Is it not good? What do you think?
We treat three diseases, or treat or prevent 3 diseases in dentistry, as you know well. Dental caries, we overtreat, and there's a lot of that going on right now because we have an oversaturation of dentists.
Yeah.
And with an oversaturation of dentists, they're going to pick a buccal pit and turn it into something monster.
Yeah.
They're going to turn something very, very low-level threat into something that seems to the patient to be a very important thing to have treated.
Do you think that has anything to do with the compensation from the insurance companies?
Absolutely, yeah. With a kid getting out of school at $200,000 to $500,000 in debt, what are they going to do? They've got to go somewhere to earn enough money to pay off that educational debt. But I'm not negative about it. Corporate right now, and this is an ADA number, I can't verify it myself, 40% of American dentists are either group, and that's as small as 2, or corporate. 40%. I think that's an unbelievable number.
That is unbelievable.
And the major proportion of that is group, but the corporate is growing very rapidly. They're 100 right now, and the younger dentists can go to corporate, earn, I'll give you the actual numbers. Typical American dentist is netting before taxes around $200K. The corporate average is 70,000 lower. So a kid can still make enough money to survive and pay back some of their educational debt, and some of these corporates will pay their educational debt.
Yeah, that's right.
So it's a place for them to go. With me, it was the military. I went in the military. I could have killed a dozen people because I knew nothing right out of dental prison,
Yeah.
and nothing. And so it takes 5 years to even know which way is up.
This is true. That's why they call it a practice.
Yeah, that's why they call it a practice. You have no idea what you're doing early
That's
on.
true.
I put the lifespan of a dentist into several categories. The first 5 years, you have no idea what you're doing. Second 5 years, you start to see a few errors you made you won't do. Third 20 years, you're rolling and you got several kids and 2 or 3 cars, and you've got a house payment, and you're churning as fast as you can go. And then you get to be about 30 and 40 years in, you know what to do, but you can't do it.
Yeah. The hands are tied.
Yeah.
That's right.
I somehow have outlived that. I don't know what the good Lord blessed me with, but I still have a lot of energy.
Well, you're very blessed. Now, those other 2 diseases in dentistry.
Okay, you got dentistry, you've got you overtreat caries.
Yeah.
We know what periodontal disease is, but we don't treat it. I've asked huge groups. Some of the groups are as high as 5,000 and 10,000 I had to get with. And I've asked them, how many of you have done 10 periodontal surgeries in the last year? I'll have 5 hands go up.
Wow.
We don't do perio. If it weren't for hygiene, there would be no perio done. We have a whole series of courses on conservative perio, where it's not hacking the stuff down. It's a period of 9 months they go through, and they do conservative perio, and they save the teeth, and they'll do that because the patient comes back. They don't come back after periodontal surgery. They're just glad they survived it.
Yeah, that's right.
And then the third one is occlusion, and dentists can't even spell that.
Yeah.
So you've got 3 major conditions we treat, and there are a lot of others like oral cancer and all the other things. But I see nothing but positive characteristics for the future. I see with salivary analysis, we're seeing the ability to find almost every disease from saliva. UCLA is doing a lot of studies on that as I speak. I see dentists are right in the top of prestige of professions, and I'm not eager for that, but in the meantime, that's some motivation to some.
Yeah.
They make a very decent salary. A typical general dentist can overwhelm a typical general physician in salary. So if they're at all aggressive and they plan well, and a general dentist can do anything a specialist can do if they go at specialist level. So I do not see any major negative. Been lots of surveys of dentists over the last while, and the vast majority are very happy that they went into dentistry.
That's right. It is an amazing profession. There's really nothing else out there like what we do. What we do in dentistry, and I'll share with you my philosophy, is we save lives.
Yeah, we
because
do.
people with teeth can live longer than people without teeth.
Yeah.
And so what we're doing every day is saving lives.
Yeah.
And that's
psychologically
important.
too.
Yeah, people with more teeth are more confident,
Yeah,
and they live better lives.
They do.
Than people with less teeth. We've seen that, and you've been seeing it for years. So
it certainly have.
yeah, I want to thank you very much.
Well, thank you. I say I've really enjoyed the group today, and they're full of enthusiasm, and they're obviously being educated well by you folks.
Thank
So
you.
congratulations to you. You're doing something the dental school should be doing. But so am I. And so should the ADA be doing these product evaluations. But there's so much of this that gets involved that the money thing has even slowed that one down.
Yeah, for sure. Well, I'm looking forward to teaming up with you on future projects and changing this footprint of dentistry forever. So
Let's do it.
again,
Let's
thank you
do it.
very much.
Thank you. My pleasure.
Thank you.
Appreciate it.